Depression, a psychological disorder in which a person experiences a bad mood, loss of appetite, reduced or excessive hours of sleep, as well as loss of interest in performing daily activities that appear for 2 consecutive weeks or even more. Most of us must already know that when someone is depressed and then do treatment to a psychiatrist, generally the psychiatrist will recommend the person to take antidepressants. One of the drugs used to treat depression is iproniazid, which is a drug to treat tuberculosis, or what we know as tuberculosis. In a study in 1952, it was found that iproniazid is not only able to treat tuberculosis, but in fact, this drug is also able to improve the mood of tuberculosis patients who also have a diagnosis of depression. Then, in 1956, doctors from Sweden tried to conduct a similar study using a drug called imipramine, or a drug commonly used to treat allergic reactions. From these 2 studies, it was found that both drugs have an effect on neurotransmitters in the brain known as monoamines. Both studies eventually led to the hormone imbalance theory, which suggests that depression is caused by a lack of monoamines in brain synapses. Then, iproniazid, imipramine, and various similar drugs are thought to restore the imbalance by increasing the monoamine in the brain. But unfortunately, the drug can affect several kinds of monoamines in the brain, so that the consumption of the drug is not spared from side effects such as headaches, confusion, weakening of the ability of cognition such as difficulty remembering or making decisions. Doctors and researchers have strong hopes of creating more specific drugs to treat depression, so they are trying to examine the content of existing antidepressants to find monoamines that have a big role in causing depressive disorders. Finally, in the 1970s, several studies found the same answer, that the antidepressants studied had an effect on one of the monoamines in the brain. This monoamine is known as serotonin. This discovery was the beginning of the production of fluoxetine or Prozac in 1988. This drug is a classification of a new type of drug called selective serotonin reuptake inhibitors, or known as SSRIs. This drug has the function of inhibiting the absorption of serotonin, so that serotonin remains in the brain. According to the researchers, Prozac has good effectiveness in dealing with depression and also has fewer side effects when compared to previous antidepressants. The maker of Prozac is trying to market the drug by raising awareness and explaining the dangers of depression. Thus, people in Western countries see that depression is a disease caused by mechanisms in the body that cannot be controlled by humans. This has led to a reduction in the culture of stigmatizing and blaming people with depression, which in turn has led many people in Western countries to take medication to overcome their depression. In the 1990s, the number of individuals taking treatment for depression increased rapidly. Psychotherapy and other forms of treatment began to be neglected because most people prefer to take antidepressants. But in reality, not everyone who experiences depression has a response to a drug like Prozac. Some people are more likely to develop an inflammatory response to drugs that affect other neurotransmitters, or even do not appear at all the healing response despite taking any medication. For many people, a combination of antidepressants and psychotherapy is more effective than choosing just one.